Well, the country is seeing what some experts are calling a tripledemic of illnesses with the flu, COVID-19, and RSV. The CDC estimates that there have been at least 15 million cases of the flu and more than 9,000 deaths. Joining us now to talk about what you can do to stay safe, we have Dr. Bobby Mukkamala. Thank you for being here.
Absolutely. Happy to be here. Thank you.
So just sort of set the scene for us right now. What are doctors like yourself seeing here in Michigan with respect to this tripledemic? Is it as bad here as it is everywhere else?
Yeah. In fact, Michigan was a little bit better, but now is catching up with everybody else as far as flu numbers. But yeah, it's certainly something that we have to deal with. Thankfully, mostly on the outpatient side, we're not seeing the toll on the inpatient side now that the RSV numbers have started to come down. The pediatric cases in the hospitals aren't quite as many as there were a month ago, but it's still filling up doctors' offices, lots of people testing positive for the flu if they get tested. So it is continuing to put a burden on an already sort of very stressed medical system.
Yeah, and I know many health officials are saying they expect a surge.
Yes, yep. And so these are infectious diseases. They're communicable. So when people get together, they tend to spread. And we just are coming out of the holidays, Christmas and New Year's, lots of people getting together, lots of people traveling for that. And so for that reason, we're likely to see an uptick like we have all along with COVID. You should stay home if you're ill, right? So if you're having symptoms, you shouldn't be out socializing and risking spreading those, especially to people that have done everything they can to try to protect themselves. They're masking, they're distancing, but you are going to be in close quarters with them in these social events. And so if you have symptoms, then out of respect for them, we should try to, just like we've learned for the past several years, stay home and prevent the spread of that infection. And if we do have to be out because our jobs depend on it, our families depend on it, then this is where the mask comes in handy again, right? And so this is respiratory spread, respiratory droplet spread. Whether you're sneezing COVID, whether you're sneezing RSV, whether you're sneezing the flu, that's how it spreads. And so putting the mask on to create that barrier of spread is going to be very helpful as well. There's so much overlap of some of these symptoms. Sure, you can find a list where, body aches may be more part of one type of infection and not another type of infection. But if you know you've got something, and most of us do, because we get the sore throat, we get some drainage, we get congestion, some coughing. It's not as important to figure out, okay, which one it is. When we know we're sick, we need to protect others from catching that. And if the symptoms progress and it's something that's more than just a typical cold, then absolutely, these things are things that can be tested for, and you should seek medical attention for that.
Is there anything in particular that concerns you more?
It gets down to what we're used to seeing, which is the effect on our health, collectively and individually, and our ability to carry out our responsibilities. One is the effect on the individual health and the healthcare system, and the other is the effect on the community as a whole. And so when people don't heed these symptoms, and then they're out and about and they're spreading it just like, they think it's a common cold, then that's when workforces get decimated. Then we run into work shortages and people are calling into work as they wisely should, but that's a preventable situation, right? So if the person that was the spreader of that stayed home, then it wouldn't have spread to the 3 other people at work that are then calling in a week later. And so there's this ripple effect on the economy that we've been hearing about as well for the past several years, in addition to individual health. And that's what I think it's important to continue to take these infectious diseases seriously so that we continue to recover instead of constantly sort of going back to suffering under the weight of infectious disease.
There is a little bit of COVID fatigue still, I think, even though we've sort of come on the other side of that. What's your advice in general for people just to stay safe and to protect each other?
Yes. I mean, if you're feeling great and you don't have any symptoms, you haven't had any exposure, then enjoy just like you have been. But if you are sick, in whether or not, again, these symptoms can be so variable, but, if you're sick, then do the right thing and keep other people from getting sick. At a minimum, that means distancing and putting a mask on if you're out and about, especially at social functions and you're not just, checking out at the store, but you're going to be with somebody for several hours like we all were just on New Year's Eve. Then that's important to sort of remember that, okay, I've got something. I don't want 10 more people to get it at this party that I'm attending. And so it's wise to be prudent about how we're spreading that. And at a minimum, interact wisely. And even better yet, if you're sick, stay home so you're not really putting anybody at risk.
Interact wisely. All right, good words to leave on. Anything else you'd like to add, Dr. Bobby?
No, just looking forward to a better year in 2023. And I think if we can remember some of these things about keeping ourselves healthy and others healthy, 2023 can indeed be much better than what we've been through in the past few years.
All right, let's certainly hope so. Thank you, Dr. Bobby, once more. A happy new year to you. And if you have any ideas on what you'd like to see here on our show, you can send them to us at WNEM-4pmnews@WNEM.com. Just use the subject 4 p.m. News Spotlight.